Hello and welcome to week 4, level 3 health and social care, unit 304, person-centered care. As I said, we're welcome to week 4 where we're looking at criteria 3.1 and criteria 3.2. So the learning objectives for these two criterias are 3.1, explain two pieces of legislation in relation to health and social care and how they impact on the delivery of care. I'm going to talk about a few different bits and I'm going to ask you to do some of your own piece of research. And in that way, you'll pick up some couple of bits of legislation. As long as we keep it confined to what we've talked about in this week, you can choose any piece of legislation as long as you can explain how it impacts on the delivery of care. So, it could be confidentiality, it could be reporting of illnesses, it could be manual handling, it can be all sorts of things, really. Okay, you just need to pick it up, give me a quick explanation of what it is and how does it impact care, how does it make care better, how does it support you delivering care. 3.2 is you're going to choose two agencies. Again, we're going to be looking at 4. So I want you to pick 2 and you're going to analyze them. So find 2 that are a bit different, really. It makes it a bit more interesting to write about because you can compare them. Remember, it's an analyze, not just to describe or explain. So you need to sort of tell me a little bit about what the differences are. I'll go over that when we go over the assignment. Okay, so first of all, you're going to do a bit of personal research for me. I'm not going to explain all of this to you. I've chosen 3 agencies for you to look into. One of them is CQC, the Quality Commission. The other one is NICE, the National Institute for Health and Care Excellence. The other one is SKI, the Social Care Institute for Excellence. Each of them have their own websites with loads and loads of information about them. So, because this is a sort of shorter session this week, I'm going to let you do some research on your own in your own private time. Okay? So, look at these 3. Find out a bit about the roles of the organization, because remember that's part of your question. What do they actually do? So don't forget that bit. I've done a sheet of videos for you for each of those organizations, telling you something about them. So please take the time to watch the videos. It will give you loads of information. You can jot down some ideas. And also research some examples of guidance that they offer. All of these guys offer some guidance, particularly number 2 and 3. Okay, jot down some examples because you're going to use 2 pieces of legislation. So some of the guidance that they give you may be written into legislation. And once you find that out, then you can use that as your answer for 3.1. Okay, so make some notes. I'm going to talk about a 4th organization in a minute, but you need to gather information for these 3. So if you want, what you can do is you can stop the slides here for a bit and you can go off and do that. You can go off and watch your videos. You can gather your information and then come back to me and look at the rest. Or if you want, you can just watch through the slides and then afterwards you can go off and you can gather your information. But then I would still suggest coming back to the slides at the end, the slides when I tell you about what to do for the assignment after you've gathered this information. It's the same as last week's session where you've got the case studies. Before you really look at the assignment, I suggest you have done that that piece of practice work with the case studies. Okay, so gather your information. So the choice is yours. You either press pause and stop now, or even press stop and then come back. Okay, when you're ready, do your piece of work, and then we go on. Okay, now I'm assuming that we're going on. And for the fourth organisation, I'm going to talk you through a little bit about it. The Health and Safety Executive, because I think it's important that people need to know about health and safety. And rather than you looking it up yourself, I'd like to talk through it. So Health and Safety Executive is a national organisation that has a role in providing advice, information and guidance. It raises awareness, but it also enforces legislation. Okay, it may license some hazardous industries, and it tells people how they're allowed to operate. So be you a factory or a biscuit making plant, a car plant, or a care home or a hospital, the health and safety exec really oversees everybody and tells you what you're legally allowed to do safely. It's all to do with keeping your people safe, not just your people though, but your employees as well. So the rules cover everybody who's in the building, not just your service users. And they are allowed to do inspections if they feel there is a concern. And if something happens, they need to be notified and they will carry out quite thorough investigations. And they have a lot of legal power. Okay, we'll talk about that a bit later on. Now, they've produced a very comprehensive HSE guidance for care homes. And it's intended to help those who are managing care homes, give them an idea of what sort of risks there are in the care home and how to manage it well. It's been really well written. It's got lots of different topics. And I've put a copy in your extra reading. And through there, it identifies some of the areas that are covered by legislation and also how doing it positively can really help with your provision of care. So it will help you again with your 3.1 question. The guidance covers RIDDOR, manual handling, COSH, that's control of substances hazardous to health, Legionella, which is a disease that happens in the water tanks. There's always a bit of a risk for care homes because of the heat, all the warm water that's being used. They also cover stress in the workplace, amongst many other general health and safety issues. Okay, so there's lots of stuff there. It's a great book to have. You can keep it when you go into your placements. It can help you reflect on things. If you think there's something in your care home that's not quite meeting what the guidance says, although this is UK guidance, it's still useful for you, and it should really be considered in most countries, because or your country will have something very, very similar, hopefully. Okay, so you've got lots of private work to do. You've got the HSC document to pick up some bits of legislation and how they can improve care. 3.2 you can look at when you've done your pieces of research on the other 3 places as well. You only have to choose 2 of those, and I've given you 4. Okay, so we'll address that a bit later on. Let's think about task 1 then, which covers all the first 4 1 criteria. So 1.1, 1.2, 1.3 and 1.4. And the first question is asking you to compare and contrast. So please note that I've highlighted it for a reason. Person-centered care with one other model of care delivery. Now, if you go back to week 1 slides, you'll see that I've given you the medical model, which is a classic one that one would compare, because person-centered care and the medical model do compare very well, and they do contrast very well because they've got very different motivations. So you'll get a very nice, clear answer. You've got 500 words here to split these 4 criterias. The empathy one can be quite difficult for you to put into short summary words, so you might need to give yourself a few more words. Okay. So compare and contrast person-centered care. You can use another model of care if you want, but I am happy for you to use the medical model. That's why I'm directing you towards it, because it's a good contrast. Okay, but remember, when it says compare and contrast, it means I want you to show me the differences. You can show me some similarities and show me the differences. Okay. With those 2 models, there aren't a lot of similarities, so you can pick out more differences. 1.2 is just to discuss. So how do you promote equality and diversity when working with service users? Go back, have a look at our stuff on equalities and diversity. Remember, it's not treating everybody the same all the time. Remember, it's identifying when people have differing needs. Somebody might need more support than others, or more help than others. You know, remember our pictures of our little man and our big man and our medium-sized man and the boxes. You know, if you give them all the same box, they still can't see. So remember to think about that. So give me a little bit of discussion. How do you promote? And that, what are you going to do? Usually means having good policies. It means having a good attitude within the team. Means maybe good communication. It's about the values of the organization as well, remember, and reinforcing those values. So have a little bit of think about that. It might be training, you know. 1.3, define the personal attributes. We did quite a lot on this. We did the 6 C's. You need to focus on them and some of the soft skills as well. So as much as you could summarize within your 500 words for your task. Okay. And the last one is 1.4, explain the concept of empathy with links to current theories. Because it says current theories, don't just give me one. Give me at least 2 theories. You can compare them if you want. You can do your Hoffman, sorry, and Golden. But just give me a little bit of differences. Show me how the theories are different. You're going to have to really, really summarize because there's obviously quite a lot of detail in there. But just pick up some important facts, some important points about a couple of theories at least. You know, again, work within your sort of word count. Okay. Everybody okay with task 1? Okay, so that's the whole of task 1, all 4 criteria. Task 2 is just 2 criteria. We're back to ethics, what we looked at in week 3. Okay, so define ethics with particular reference to medical ethical principles. Give me a definition, a brief definition. Okay, and then maybe run me through the principles. Now you know them now: non-maleficence, beneficence, justice, confidentiality. Okay, so just give me a little summary. Try to put it as much into your own words as possible. Okay, and just give me a little definition. What is it? So I get from what you understand what ethics is. Particular medical ethical principles focus. So don't start getting tied up. A lot of people, when they Google it, they get involved with ethics of education, ethics of business management, and that. Really keep it focused on medical ethical principles, please. There's plenty enough information. You should be able to just do that from the slides anyway if you want. But don't forget you need some citations. Okay. And if you're just quoting me, try and find a citation. So if you're using something from the slides, if I haven't put a reference at the back, then try and find one of your own. I'll give you more marks if you find a reference of your own. Okay, don't just put it to my slides, because you'll lose marks on your referencing for that. The second part of this is to identify the ethical issues from the case study. Now, remember, I gave you 2 case studies for week 3. All you need to do is just pick one of them to write about. You don't need to tell me too much about what's in the case study, but you do need to identify which one you're writing about, so I know. Okay, it's the first one or the second one, but use their name. Maybe that would help me. Like one of them's called Joan, I think the other one's Mr. Green. In looking at Mr. Green's case study, I think the ethical issues are. So you pick out from that case study what the ethical issues are and how can they be resolved. Okay, so what would you do? It might not just be you, it might be your whole team, it might be somebody else's job, but just say what you would do to resolve them. So you'll get marks for picking out the ethical issues, and you'll get some marks for coming out with a resolution. If you only pick out the ethical issues, don't give me a resolution, you only get half the marks that you could. Okay, 250 words. So you can be quite brief with 2.1 if you want to say a little bit more on 2.2. Okay. Finally, task 3, which is looking at some of the stuff we've discussed today. You've got 3.1 and 3.2. Okay. Discuss 2 pieces of legislation. So you've looked at 4 different organisations, all of which might mention some legislation. Certainly know the health and safety exec, nearly all of it, their stuff is legislation. CQC might have some legislation as well. The NICE mentions legislation. So you can either pick one from the information you write about them, or go straight to health and safety legislation if you want. I don't really mind. Just come up with 2 pieces of legislation, explain them. Explain to me briefly what they are. You haven't got a lot of words, so keep it nice and to the point. How do they impact on care? Okay. So if you look up something about confidentiality, there's legislation around that because it's data protection. How does that impact on care? Is it good? Does it make it difficult? Does it make it easy? It should actually make care easier. That's why these bits of legislation exist. But just, if you think there's a problem, like they have to spend too much time writing up a report or something, you can say that if you want. That's fine. And then analyze the role of 2 agencies. Here you should have done a piece of research into 3 agencies, watch their videos so you find out all about them, and then done a bit of reading about the health and safety exec as well. So you've got 4 agencies. You can choose 2 of them who provide guidance. So any one of the ones we've mentioned here, I would stick with them if I was you, and just analyze them. So give me a bit of comparison. So they might have different roles. Okay, CQC is a regulator. NICE is not a regulator, it's educational, it's the institute. Well, they've got a bit of regulation role when it's to do with medications, but SKI is not. So SKI, Social Care Institute of Excellence, is all about research, education, development, practitioner development. So you could give me an example of those. Health and Safety Executive, very much focused on health and safety. CQC is much more focused on the whole care, health and safety is just a small part of it. So give me a bit of comparison, really, but you need to do a little summary of what they actually do so that I know that you know what those, the 2 different agencies you talk about, I know that you know what they do, okay, and how they provide their guidance. Okay. So any questions? Usual thing, you can WhatsApp me or you can WhatsApp the whole group. I find that better because instead of 3 of you asking me the same question, I can then share my answer with the whole group. So don't be bothered if you ask me a question and I might send the answer to the whole group, because it might mean that someone's just about to ask me that question. Okay, but please don't forget to ask me if you're not sure of something, rather than go ahead, make mistakes. Okay, don't forget your citations. The answer, each task should have at least a couple of citations in it. You should have something for every criteria, really. And as I said, I do not want you to use me as a citation. I do not want Sue George puts his slides to be one of the citations. You can find a citation for any of these things. You've got to do some wider reading. I've given you some extra reading. So you can quote from the extra reading I've given you. Say, like with this week, you've got the health and safety document, health and safety in the care homes. There's, so you could cite that if you wanted. Don't forget your references. Nice reference list, Harvard style. Some of you still lose marks on this when you don't need to. If you're not sure of what you're to do about referencing, please, the referencing guide is still up on Google Classroom. Read it over again one more time if you're not sure. I have added a little quiz for this week. There's a quiz for each week for this unit. So do the quiz, because that helps you get things straight in your mind as well. Okay. And like I said, please don't forget to ask me. When the assignment goes up, you'll be told the date of hand-in. Try to meet the dates, okay? Because it's easier for me to mark when they're all there. Okay, that's it. I thank you. Good luck with the unit.